All right, so we're going to go ahead and get started. Uh, my name is Sarah Remberg, and I want to welcome all to Headway Foundation's second webinar, Omega-3s and Concussion. Today, we are lucky enough to have Dr. Michael Lewis joining us. Dr. Lewis is an expert on brain health and TBI management. After a distinguished 31-year career in the U.S. Army, he retired as a colonel in 2011 and founded the Brain Health Education and Research Institute. He now operates his own private practice, Brain Care, in Potomac, Maryland. In addition to graduating from Tulane Medical School with an MD and doing postgraduate work at Walter Reed Army Medical Center and Johns Hopkins, he's a board-certified fellow of the American College of Preventive Medicine and the American College of Nutrition. He's also the proud author of When Brains Collide, What Every Athlete and Parent Should Know About the Prevention and Treatment of Concussions. I hope to have half as impressive a bio when I'm older. Before we begin, I'll just go over a few things about the webinar. Dr. Lewis and I will present for about 30 to 35 minutes. You all will be muted the whole time. If you have a question, please click on the Q&A button at the bottom of your screen and type your question, and we will get to it at the end of the presentation. If you're having a technical problem, please click on the raise hand button and I can chat with you directly. Thank you for giving us your time today, and we hope you learn a lot. All right, so I think it's a safe place to start that we discuss, what are omega-3s?
What are omega-3s? Well, that's an interesting question. Basically, omega-3s are fats, a particular type of fat, and some would say, including myself, that they're the healthy type of fats. So you've got, of course, saturated fats and monounsaturated fats and polyunsaturated fats, and omega-3 fall in that last category, along with other polyunsaturated fats such as omega-6s, which both omega-6s and omega-3s are absolutely vital. You need them both to be able to, for life, but also to build a brain in utero and maintain brain health. But omega-6s are very pro-inflammatory, while omega-3s balance that with the resolution of inflammation in basic terms. And the problem is our society has become way out of balance on too many omega-6s in the American diet.
So how do omega-3s and nutrition impact the brain?
Well, from several different ways. So when we talk about omega-3s, there's two of the long chain omega-3s that we have to consider. We have to, and I'll just give you the initials, EPA, which is often known as the heart healthy one. And the downstream biochemical effects of EPA are heart healthy, help keep platelets from clotting too rapidly, basically opposite of omega-6 stuff, but also help relax blood vessels. So EPA helps get more blood flow deeper into the brain. DHA, the longer chain omega-3, is basically like one of the bricks of the neuron cell membrane. And so along with arachidonic acid, the omega-6, DHA, the omega-3, are part of every cell in our body, but nowhere is that more important than in our neurons. And when those two omegas are released through mechanisms, they have very different downstream effects. The omega-6s being very pro-inflammatory to the brain, and the omega-3s being anti-inflammatory or pro-resolving.
So how would omega-3s play a role in concussion recovery? So walk us through sort of the process by which adding omega-3s to your diet can help heal the brain.
Well, the idea is to saturate the brain with what it takes to make a brain in the first place. And you can't have a discussion about omega-3s without also talking about omega-6s. And so are the enzymatic processes that are meant to deal with it as we developed as a human being over tens of thousands of years. These two these two omegas, the omega-6s and omega-3s, were meant to be in balance. And we've become so out of balance because of our food supply and the way we eat and how we process food and eat junk food and so on. Um, we've become so out of balance. Instead of that even balance, we basically are around 15, 20, even 30 to 1 out of balance of too many omega-6s to omega-3s. And so as you saturate, so we got two choices when it comes to the brain, and more particular when you come to a head injury. You either need to lower the omega-6s, which is great and really, really important, but that takes months or years, if you could even do it, given the way that our food supply is today. The other side of the coin is you can increase or rapidly increase the omega-3s very quickly through supplementation, in addition to what you should be eating on a regular and healthy basis. And so those anti-inflammatory effects help resolve the inflammation that occurs after a concussion, after a head injury. We really are hurting. We're lacking in the omega-3s as a percentage as compared to our omega-6s to be able to resolve that inflammation. And so if you don't resolve the inflammation, that's part of the reason why we see post-concussive syndrome and the symptoms that continue. You have to understand, when you have a head injury, that's just the beginning. There's the whole secondary biochemical response following that primary injury. And if we don't undo that secondary biochemical cascades, also known typically as inflammation, if we don't stop it, undo it, resolve it, it's going to continue to burn like a smoldering fire through the brain, causing the symptoms that you experience in post-concussive syndrome for days, weeks, months, years, decades even. And I would argue that this problem that we're seeing with NHL and NFL and so on with CTE, chronic traumatic encephalopathy, as well as Parkinson's, like you saw in Muhammad Ali, and even Alzheimer's, are a result of that chronic inflammation never getting resolved.
So is there controlled research that's been done on the use of omega-3s in TBI, and can you walk us through some of your research that you did to give a bit more of a scientific backing?
Well, omega-3s are one of the most researched substances, and certainly one of the most published substances in the medical literature. Some people say over 90,000 scientific articles exist in the literature, and tens of thousands of clinical trials. Most of that was started out of the 60s into the 70s dealing with heart health, and through the discovery of what omega-3s are and how they help and are healthy for the heart. So the large portion of those is from heart health. But then people started to notice that it also had an effect on mood and brain health. And so there's a growing amount of literature about brain health in general, and mental disorders or psychiatric or psychological disorders, everything from showing that it's omega-3s are very beneficial for ADHD, depression, and so on. The idea of omega-3s and traumatic brain injury is actually fairly new and didn't really start until Julian Bales, neurosurgeon at the time at West Virginia, now at Northwestern, University of Chicago, when we started looking at this about 10 years ago. And so there are not a lot of clinical trials, partly because when we're talking about clinical trials in nutrition, we are terrible about designing them, number one. Number two is head injuries are incredibly difficult to research. I mean, they're like snowflakes. So a head injury two head injuries, no two are alike. And so they're really, really difficult to look at. And we don't have good outcome measures because we can't even define what a head injury or concussion is in the first place. So doing research on it is incredibly difficult. There is some animal research that's come out. Dr. Bales led some of it that showed tremendous value in giving experimental animals omega-3s after an injury and showing what it does to the brain, how it helps restore brain, the neurons, and keep them intact. He also did research looking at it preloading before an injury and how it helped prevention. But I also then go to, so if we don't have a lot of direct research on head injuries, look at other things. And so one of the areas that there's a little bit more research on is stroke. And so while the mechanism of injury for stroke is different than a traumatic brain injury, those biochemical cascades, that whole secondary response, that churning and burning of the brain cells, that's the same as stroke. And there's some great animal model research in stroke and as well as in spinal cord injury. But there's very few human clinical trials because basically it's a new concept over the last maybe 8 to 10 years that's really starting to catch on. There's a few clinical trials. TCU did one with their football team in 2014 and showed that omega-3s help decrease some brain injury factors, blood biomarkers in their football team. But that's really one of the only major clinical studies out there.
So you've pioneered an omega-3 protocol for after a concussion occurs. Can you walk us through what that is and then also how you handle cases years afterward?
So I don't handle fresh cases, if you want to call them that, versus the ones that are years afterwards. I don't really handle them that different. And if somebody were to come to me saying, "Do you think it might work for ADHD or depression or whatever?" I'm gonna basically go down the same road. And it's that concept of we need to lower our omega-6s, and that's great. And like I said, that would take months, probably really years, and it'd basically be impossible. So it's much more important, how do we get that balance back as quickly as possible? And so I do it on the omega-3 side. How do we plus up the omega-3s? Well, the FDA tells us that what's generally recognized as safe, or GRAS levels as they call it, are 3,000 milligrams of combined EPA and DHA a day. And that's all well and good. The EU and Europe and I think in Canada actually as well, they consider 5,000 milligrams safe to use on a regular basis. And so I looked at that and said, okay, well, most people don't take 3,000 milligrams of EPA and DHA, because that means typically, depending on how good of a fish oil, anywhere from 3 to 10 capsules of fish oil just to get that amount of omega-3s. But I want to load people up quickly because I want to change that balance as quickly as possible. So I take that 3,000 milligram dose, or I call it a dose, and then I triple it. I tell people we're going to do a loading dose for at least a week, probably more like along the lines of a month. The worse the injury or the longer ago the injury, it's more important to do it for a longer period of time. But I take that basic dose and I triple it for a while to get those blood levels back to where they should be in balance before I get down to that regular daily it's not a recommended amount, but the generally recognized as safe amount.
Gotcha. So you mentioned fish oil, so is that the most common way and most effective way to go about supplementing your omega-3s?
Well, the most effective way is to eat really healthy, good salmon, sardines, good quality fish that are high in omega-3s, but to eat them on really a daily basis, at a minimum 3 good meals a week. But if you really want to make a big difference, you got to do it on a daily basis. We don't do that in America. I mean, if you're in Japan, that's different. You're probably eating fish breakfast, lunch, and dinner. If you're in Iceland or Greenland, I mean, it's very different. But we don't do that in America. We have this aversion to fish, and it's not cheap. To get really good quality salmon, and I'm not talking farm raised. I'm talking about good quality salmon. It's not cheap. It's actually probably cheaper to do supplementation. So the best way is eating really healthy, but we don't do that so well as a society, and most individuals will never do that well enough. And so I advocate, let's make up for it. And that's why we call it supplementation. It's not a replacement, but it needs to be a supplement.
And what makes a high quality fish oil? So what are you looking for our viewers?
Well, first of all, I would say, there's a couple different factors. Most fish oil that's available on the market undergoes things like molecular distillation, which is basically how to clean it to get the mercury and toxins out. And so that's obviously a really important step. But when doing that, part of the molecular distillation process is taking that fish oil and breaking it apart. So an omega-3 is a triglyceride. If you squeeze a fish, most of what you get is in triglyceride form. So you've got three free fatty acids attached to a glycerin backbone, and so you basically break that glycerin backbone, but the fatty acids have to be bound to something, or otherwise they're not stable. Just like sodium needs chloride, to make salt. And so we have to bind the fatty acids with something, and we bind it to alcohol. And so that's called an ethyl ester, and then we precipitate that out and just put it into a capsule, or we might concentrate that and put it into a capsule and sell it. And our bodies don't know how to handle ethyl esters. It's no longer an oil. It's no longer a triglyceride. Our bodies can't digest it very efficiently. And typically that's what causes a lot of the GI disturbance when people take fish oil and they say, oh, I get fishy burps. It's usually the form of the fish oil. It takes another huge step of manufacturing to put it back into a triglyceride form, which is much better absorbed, much better tolerated, a lot less side effects.
So what are some of the most common symptoms that are helped with the high doses of omega when you see patients?
Well, when you look at a head injury patient, a concussion patient, they typically, there's four sort of categories of symptoms. Sleep being one of them, so issues with sleep. Omega-3s have been shown, and particularly in kids in ADHD studies, that giving kids omega-3s, actually in this one study done in the UK, the kids that took omega-3 slept 48 minutes more per night than the kids that didn't take fish oil. So sleep's a really big issue after a head injury, and so omega-3s can help with that. We have sort of the physical symptoms, the headache, the dizziness, and so on. And my experience with patients has been that omega-3s can really help with headaches very quickly. So then you've got emotional, and so when I mean emotional, irritability, depression. I mean, part of depression after a head injury is I'm not getting better, and and it wears on you over time. But anxiety, depression, and irritability are several of the problems that we typically see, and I found great success with omega-3s to help with those symptoms as well. And lastly is how do I describe it? Cognitive. Thinking. One of the problems after a head injury is you feel like you got the worst head cold without the runny nose, right? You got somebody stuffed your head full of cotton, and you can't think. You're like thinking like in slow motion, or you can't think through things. we call it brain fog is probably the most common way to describe it, and it's almost like perfectly descriptive, right? And so brain fog, it's one of those things that basically I've had people just say, it's like somebody lifted the veil of fog, and I'm able to think again. And so those are, and covering those four main areas, omega-3s address many of those. Everybody's different, and sometimes it's going to work for some people and for some symptoms, and other people it may not. And so everybody's different. How everybody reacts is different, but across the board, I've seen a lot of good improvement in most of these areas.
Yeah, I know I've personally benefited from your protocol. Is there any downside? I know people who've been through the ringer with concussion might be hesitant to try something new. So if you want to walk us through any potential issues.
Um, well, number one is if you're going to basically, the easiest way in, talk about 3,000 milligrams and then tripling that. Okay, let's get down to really the simple thing is whatever fish oil you think you're going to use, and I would recommend, getting better quality triglyceride form fish oils that are concentrated. So in a 1,000 milligram capsule, it's going to provide you with 800 or 900 milligrams of omega-3s. Most, you go to CVS or Walgreens or Rite Aid or whatever, and you just get the basic generic fish oil, it probably has 300 milligrams in a 1,000 milligram capsule. So, what's the other 700 milligrams? I don't know, because they don't put it on the label. So, brass tacks, whatever fish oil you have and whatever the recommended dose, double it just right off the bat. And then that's the starting dose. And then you want to triple that on top of it. And so if we're going double and then tripling, so times 6, so then so one of the issues is going to be expense. Better quality fish oil does cost more, but you don't have to take as much of it, and you're going to get a better effect out of it. So it's an expense. It might actually cost you, $60 or $70. And if that is something that's going to put a stop to you pursuing something, then we're talking in the wrong direction, I guess. So that's the first thing. Second thing is people tend to, not everybody tolerates fish oil gastrointestinally, and so they might have problems with their digestion. Just whether they can keep it down, or they might complain of fish burps or whatever. A lot of times that's because of the quality of fish oil. And one of the concerns is with too much. The reason why the FDA talks about 3,000 milligrams as they generally recognize as safe is there are theoretical concerns about bleeding. Well, that's one of the reasons why omega-3s are heart healthy. Just like taking an aspirin a day, omega-3s at higher doses help decrease the platelets from clotting too much, and that's actually a really beneficial thing. But we take that way too far, and we say bleeding's an issue, and you could bleed to death, or it might cause a brain bleed or a stroke or something like that. Those doses are so high, nobody would ever be taking those on a normal basis. So it's an unfounded, never been proven to be an issue in any clinical study in the scientific literature at all. That said, would I have somebody, a football player or a hockey player, playing on those loading dose levels? No, I would not at all. I think they should be on a regular sort of daily dose, but I would never want an athlete to go out putting themselves into a collision sport on the really high doses, mainly just to be safe, to be conservative about it.
Gotcha. Well, all right. So now we're going to move into the Q&A portion. So if you haven't already submitted your questions, please do. Our first question is, what are there any specific brands of fish oil that you recommend? What brand do you prescribe people? And is it better to get it a prescription-based fish oil?
Well, almost all of the prescription-based, and basically, actually, I think every single prescription-based fish oil is an ethyl ester. That cheap, terrible, horrible form that costs basically nothing to put into a capsule, and they sell it for $13 a pill. because it's a pharmaceutical. I wouldn't prescribe any fish oil to anyone, of a pharmaceutical fish oil. Would not ever do it just because they're horrible. And so you've got to go out and look into the nutritional supplement industry. And sure, there's issues with the nutritional supplement industry, but you want to find a good quality fish oil that's in triglyceride form, and there's a number of them out there. The one that I like to use the most are the three that I like to use the most. Nordic Naturals, they've been the industry leader for 20, going on 25 years now. They have come out with a new, even more concentrated capsule, and on their retail side, Ultimate Omega 2X, on their professional side through doctors' offices and such, Pro Omega 2000, where it has 1,000 milligrams of EPA and DHA in a single capsule. So you really only need to take 3 capsules as a dose. The Pure Encapsulations is the second one I would mention, and they have the exact same product, that 1,000 milligrams in a single capsule, and they call it Pure Encapsulations, ONE or 1 Omega. And then the third one is there's 2 rugby players out of Chicago that reached out to me a couple years ago and said, hey, how many, it's really confusing how many fish oil capsules we should take. What if we put it all in one bottle, like a 2-ounce little bottle, so that's a whole dose of fish oil in a single delivery system. And they went out and did it. And their product, which you can only get online, it's a small startup company. They're called Remind Recover, or remindrecover.com is where you can order that from. Pure Encapsulations, Nordic Naturals, you can usually get them at Whole Foods, good health food stores, some GNC type and vitamin shop stores, not all, and online.
You're gonna love this question. Why are neurologists, especially the ones who treat concussion patients, not aware of this omega-3/6 supplement ratio issue and supplementation to support brain injury? This person says they've never heard a neurologist recommend anything to do with nutrition. So, care to comment?
How much time do we have? All right. The short answer would be doctors are not taught about nutrition in medical school. And so everything I'm talking about here, I had to basically go out and learn on my own because I had an open mind. I'm not a neurologist. And so in many ways, I wasn't hindered by my training and my education. And so I came at this from my board certification's in preventive medicine. And so trying to keep people healthy and out of the hospitals, very different approach to medicine than our medical system today. To call it a healthcare system is a complete misnomer. It is nothing, there's no health in our healthcare system. It is a medical care system, not a healthcare system. And doctors are just not trained in nutrition and how to prevent things or how to deal with it nutritionally. Post World War II, we had penicillin and we had antibiotics, and then we came out with vaccines and we put a man on the moon, and we had all these great successes. And so we basically got in this mentality of, hey, I can write a prescription and here's a drug and your symptom will go away. Hey, my problem's done, go on to the next. And that's not dealing with the underlying issue. And the underlying issue really is nutritional and nutritionally related. We're just not taught that.
Yeah, that's a good answer. So what is the difference between like omega-3s and farm-raised versus wild salmon or other things?
You are what you eat. So nowhere is that more important than our brains. So you, me, you're listening, everybody's listening. You are what you eat. We're supposed to learn that in kindergarten, I think, right? But what you don't necessarily think about is so is the the food supply. And so it doesn't matter whether you're talking about chickens or beef or anything or seafood, they are what they eat as well. It's part of the food chain. And so not only are what we eat, but so is the fish. So you have farm raised fish that are being fed soybean and corn and who knows, God knows what. That's what you're going to get versus wild caught salmon, for example. They're not being fed soy and corn. They're out eating littler fish or algae, or you know, and they're building up their fat stores because the salmon, of course, is going to want to go back up the river to where they were spawned from, and so they have to build up the energy stores to be able to they're not stopping to eat at McDonald's on the way, when they're swimming upstream. And so they need to have the fat stores for energy to get all the way up. And they usually have just enough to, when they get up to their spawning areas. And so if you catch them just before they enter the river, they're going to be at their fattest. And that fat, EPA and DHA, they're cold water, deep cold water fish. That's why we find, Alaska and Canada and so on, because the omega-3s are like an antifreeze as well as a fat. So it keeps the fish body from freezing. And so it keeps the blood circulating. We talked about that a little bit, but the fat content of salmon just before they start to swim upstream after being out in the ocean for a couple of years building up those fat stores, that's the optimal place to get your EPA and DHA. Sorry, a little bit longer answer than I intended on that.
That's fine. So we mentioned earlier that omega-3s can be used as a preventative measure. Do you want to elaborate a bit more on how that's done? We have some athletes listening.
Well, I think that, yes, awareness is greater. And certainly that's probably the most important thing that's come out of this whole NFL issue, which has kind of been where the spotlight has been. I know hockey's an issue and soccer's an issue in that, but the NFL's really hogged the spotlight, much to the dismay about this. So our awareness is greater, and that's really led to some good changes and much more awareness. So are we seeing more concussions now, or is it just greater awareness? I'm absolutely convinced that we are seeing not just the awareness, but we actually are seeing and are experiencing more concussions now than we were 20, 30, 40, 50 years ago. And I think we have a lot worse outcomes. And I would love to be able to prove this, but I would absolutely correlate it to our nutritional status. And because our nutritional status is so much worse off than it was 20, 30, 40, 50 years ago, I think we're more susceptible to concussions and worse outcomes. So how do we reverse that? How do we do the preventive mode for that? And the preventive mode is change how we eat. And if we can't change how we eat, at least supplement on top of how bad we eat with all the right things. And so I advocate that people should be taking 2,000 to 3,000 milligrams of EPA a day on a regular basis, every single day. My kids do it, I do it, and that's what I would recommend, so that we're getting ourselves more in balance before an injury occurs and possibly preventing an injury. And by the way, you can measure this. And so how do you know if you're getting enough omega-3s? Get a blood test. You can actually do omega-3 blood tests and see how you are. You can get a baseline and see how bad you are, and then start your supplementation and check it a couple months into it, and see how much better off you
are. Could you talk about the in-depth chemical reactions that result in omega-3 reducing inflammation? That's an audience question.
Yes, I can. However, we don't have 3 hours, so no, I'm not going to. I'll just say that omega-3s, the EPA leads to the downstream biochemical cascades through eicosanoid pathways. They also influence nitric oxide pathways. The DHA downstream effects affect the docosanoid pathways, which lead to things called resolvins and neuroprotectins, which kind of give you a pretty good clue of what they do. And then there's, just recently came out a really nice scientific paper about how omega-3s interact with our endogenous cannabinoid system to influence and positively balance our brain health as well as our body's inflammation and response to inflammation.
And then the last question is about the ratio of EPA to DHA. Does that matter? How does that affect, quality?
That's actually a really good question. EPA is thought to be more important in mental health, things like depression and so on. So when we look at analyses, meta-analyses of omega-3s as basically an adjunct or even as a primary therapy for depression, it's been shown that formulations higher in EPA are more helpful than sort of DHA predominant ones. In brain injury, it's probably the opposite. It's probably that we need higher amounts of DHA, but I would never discount the value of EPA. EPA is an anti-inflammatory, helps more blood flow get to the brain, which is a big issue. So one of the big changes out of the Berlin conference recently is that, advocating, and other people have been advocating this as well, is to get back to aerobic exercise as quickly as possible because it increases the blood flow to the brain. Well, EPA does a very similar thing, so imagine the combination of the two. So I don't get all wrapped up in the different levels of EPA and DHA. I think both of them are important. It'd be great to just have a 50-50 kind of thing. I think both of them are important. There's just not enough. We can't even get the basic studies done because it's the nutritional industry. There's not the big margins, profit margins that you have in the pharmaceutical industry. So who's going to pay for these studies that haven't been done, that need to be done? And the answer is they're not going to get done unless some philanthropist decides that this is what they're going to take on. But I don't see that happening anytime soon.
Then a last minute question is in increasing your fish intake more than 1 to 2 times a week, do you worry about harmful mercury levels?
That's why supplementation can be a really important part of increasing your omega-3s, because you don't have, with good quality fish oil supplements, you don't have to worry about mercury and PCBs and neurotoxins or toxins and heavy metals and so on, because that's part of the manufacturing process, is to clean those up. And any good company will be able to they'll either put it up online, or if you request it, they'll send you the third-party evaluation reports of what's found in their capsules by lot number and so on. So no, I don't worry about it on the supplement side. On the fish side, that's why good quality, I recommend Pacific Northwest salmon, some of the smaller fish. So it's the bioaccumulation. Smaller fish don't have as much mercury because they haven't been exposed to it, versus the bigger fish, things like sharks, even tuna. In some cases, certain types of tuna, because they're bigger fish, are eating smaller fish. When they're eating smaller fish, they bioaccumulate mercury and other things. So there are certain types of fish that are known to be higher in mercury, and certain types of fish that are known to be much, much lower risk in mercury. And when we talk about what the EPA is looking at it and saying, oh, you shouldn't eat more than 1 or 2 servings, or pregnant women shouldn't eat fish because of the potential contamination with mercury, what they're missing is the potential. On the other side, what is the potential loss of the value of the EPA and DHA by pregnant women not eating fish? And if you actually put them on the same scale, it's been estimated that mercury will decrease the IQ of offspring of a pregnant mother eating fish. Mercury can potentially decrease that IQ by a half a point, 0.5 IQ points on average. The potential loss of from not getting that EPA and DHA is 6 to 7 IQ points. So we're not seeing what's the saying, we're not seeing the forest because of the trees or whatever. I mean, you're getting down into too many details of mercury's a bigger issue only because people have made it a big issue. It's really not.
All right. Well, thank you guys for joining us today. So if you want to buy Dr. Lewis's book, When Brains Collide, you can get that on Amazon. It talks a bit more about the use of fish oil, includes the protocol, and talks about how he came about the research. If you want to learn more about Headway Foundation, please go to www.headwayfoundation.com. If you want to watch this webinar all over again because you loved us so much, the webinar will be posted later tonight to our website. So thank you guys for joining us, and I hope you all have a great day.